Ladies and gentlemen, Dr. Payal Kohli is back. We're so excited.
She's just part of the team now.
Like, she's going to be in the seat in a second. She will take over my position.
That would be amazing.
Never! Okay.
You're irreplaceable.
Thank you. Oh, heart bubbles. We have a lot of questions about the coronavirus. We've talked a lot about how it can affect us physically. But let's be honest. Let's talk about how it can affect us mentally. What can we do to keep our anxiety in check? It's real. Yes. It's happening. Let's get to some questions, Jeff. Go ahead.
All right. The first one is, who was that? Marlon wants to know. I was like, where am I reading this from? Should older people still watch their grandkids?
Great question.
Great question, Marlene. And the answer is no, not at this point, because we're thinking that kids are actually the carriers for a lot of these infections. And maybe the contribution of asymptomatic carriers to infecting vulnerable populations is higher. So I know it's difficult because the kids are out of school now. And what do you do with them? But really try to separate kids from older parents as much as you can. They can interact on FaceTime, they can call them, and it's important to still keep doing those types of things.
That's a really good question, actually, because I think a lot of people were babysitting because they're at home, and you have the kids babysitting the grandparents, stuff like that.
Yeah, but look how lucky we are in this day and age to have something like FaceTime to interact with your grandchildren, whoever. So take advantage of that.
Cook a meal together.
Yeah.
Huh?
Yeah.
On FaceTime?
Yeah.
Or play a video game.
A little Scrabble.
Yeah.
Huh? Yeah. Okay, so Jimmy asks, will the virus come back in waves or cycles, and when? This goes along with the anxiety of we don't know what's going on.
Yeah, so I really want to set the expectation that this virus is not something that's just going to go away. The CDC is anticipating that it may be around till the end of the year, maybe even next year, and it may become something like the flu virus that we go get a shot for. So I think we really have to change our mindset about how we think about this virus, not that it's going to go away, so much so that we can contain it and control the spread of it.
Okay.
Here's a good one from Missy. She asks, is there anything you're feeling hopeful about when it comes to having a vaccine or our power to isolate the virus?
Today, I'm extremely hopeful because
you had a smile on your face while I was reading that.
Do you know why?
Why?
Because the first patient undergoing clinical trials for the vaccine was today.
Okay.
Yeah, so I'm really excited that we're working and making progress. Now, it's still probably going to be a few months before the vaccine comes out, and that's where our measures are really going to help with social distancing and all of those types of things. But I am very excited that we've already gotten it into clinical trials this quickly.
Okay, that's great. I do have a question from YouTube. This is Curtis Mayfield. What's the latest data regarding demographics for the deaths in Italy? Some reports were showing increased numbers in 20 to 40-year-old males. Italy had like 400 deaths in one day and like 21,000 new cases. But is that because they're now testing? Is that right? And is it males or demographics? Tell us what you have to say.
So deaths are very complicated. They're because of the virus itself, but it can also be because of the healthcare resources that are available and the government's response. So one of the challenges we've had in Italy is that the healthcare system has gotten overwhelmed with the number
beds and all
of people that have gotten sick at the same time. Yeah. So one of the reasons we're seeing a higher mortality rate in Italy is because of the lack of resources.
Wow.
And even healthcare providers themselves are dying more frequently because there are fewer of them. There's not a lot of personal protective equipment to protect them.
So if you're not really sick, stay home.
Absolutely.
Am I right? I mean, because we're going to overrun this hospital. We don't have enough ventilators.
Well, and that sounds scary when we say it. But again, if we get all hands on board and we start to change the spread of this virus with social distancing, we can really space out. But if we continue at the rate we're going, you're right that this country has 100,000 ICU beds with ventilators, and we're anticipating 200 to 250,000 people will need ventilators. Wow. And we don't want to be in that situation that Italy is in, because then people do end up, unfortunately,
Let me ask you just
dying.
a strange question, and there is no number to this, but how many people are going to actually have the coronavirus, pass it through their system, and not even know it?
We don't know exactly
I know you're
the
not
number,
gonna know that,
but a large majority are those asymptomatic carriers, and kids are the ones that stand out, but even some adults will just have a cold, or some will have no symptoms at all and not even know it, which is why it is so important, whether you're sick or not, to be clean, practice hygiene, to practice social distancing, because you may be infected with the virus and not even realize
you could be carriers, and that's just as dangerous. It's like a loaded weapon. So please be careful if you love our elderly. Thank you again, Dr. Kohli. You're wonderful. You look great in blue.